Candace, I'm so glad you're taking the time. This is a big day for a lot of families as they watch what's happening at this courtroom in Woodstock, Ontario. Now, we know that Wettlaufer says she used insulin injections and that she knew the supplies were not closely monitored. How common is that drugs are not closely monitored in long-term care facilities like Crescent Care?
Well, first, let me say how tremendously devastating this is for everybody involved, every family member, every person that's been touched by this. I think it's important to say that there are different levels of medications that are in a long-term care home, and some medications require different policies and procedures around storing and implementation and discarding. And insulin is one of those medications that is not a medication that is double signed. And unfortunately, nobody could have ever guessed that somebody would do this.
You know, you couldn't guess it, but perhaps I'm wondering if the ground was fertile to allow it to happen.
I don't think so. I mean, if you look at our compliance system, we're the most heavily stringent compliance system in North America. There is not any kind of regulation that could have prevented something like this from happening. So it's devastating, because you can't imagine somebody going into the nursing field to intend to do harm to somebody.
But you're not giving me much hope, Candace, for change if you say that, you know, you could never expect this to happen because there are so many regulations. Well, it happened. So how do we make these homes safer for what we already know are a very vulnerable part of our population, and that is the elderly?
I think what we need to learn from this, I think we need to look at insulin administration. You realize that you can go in on the street into a pharmacy and buy insulin. So maybe this is something that we need to look at. We need to do a deep dive, and we need to determine, is insulin a drug that should be double signed? Is it a drug that should be changes around implementation and administration? I mean, you can get insulin if you're a veterinarian. You can get insulin for yourself. So I don't think it's the insulin. I think it's fact that something really bad happened, and we need to determine that this is an anomaly. This is the first time in Canadian history somebody's ever done this in long-term care. It's devastating.
Let me just quickly ask you what you mean by insulin should be double signed.
Well, if you look in long-term care homes, there are some medications such as narcotics, anxiolytics. There are some medications that have to be double signed. So if an RN or an RPN goes to give a medication at this level, then they have to have another nurse sign on it and sign off on it.
So what else do you think needs to change, other than perhaps double signing, as you say, on the administration of some of these drugs, but to prevent this kind of thing from happening again? Because we are going to be hearing shortly, over the next number of weeks, victim impact statements, and they will be, as you started by saying, tremendously devastating and emotional. So how do we ensure that this doesn't happen again?
I think that the only thing we can do is look at where we can have medications that are in our homes that we're administering that could have a detrimental impact like this. Honestly, I don't know how you would prevent this from happening again with added legislation. We have so many processes and policies and human resource programs in place right now. It would be very similar as to, how do you determine someone's going to walk into a mall and shoot people? How do you, you just can't diagnose severe mental health issues with somebody.
I mean, I think it's apples and oranges, really. Somebody walking into a mall, they haven't been hired to protect the people in that mall, right?
That's right.
The long-term care workers have been hired to ensure the care.
I fully get that. And there are human resource policies in place that everybody has to follow. But I don't know if there's screening in place that screens if somebody has an intent to harm somebody and murder somebody. I really don't.
Final question for you, Candace. What about cameras? How does the association, how do you feel about that kind of monitoring in a room?
There are already a lot of homes that have cameras in place. There are what people call granny cams. A lot of families choose to use them. People know that. I think there's more technology that's out there right now that when it comes to medication administration that we could look at, where you are basically putting your fingerprint in when you're giving a medication, and only that medication is dispensable, so that you can't just open a drawer and access different medications. So I think that's the technology. That's the piece we need to look at to see if we can minimize the risk.
Candace, I'm so glad you took the time to talk to me. I appreciate it.
Thank you.
Candace Chartier is the CEO of the Ontario Long-Term Care Association.